Hello, thank you for watching this video. Today I'll be discussing my research into how to reduce public speaking anxiety of university students using Imaginal home practice and virtual reality-based practice. My name is Josh Brunotte. I'm based in Japan. I work at Aichi Prefectural University near Nagoya, Japan. So I'm an EFL instructor in my university, and I've been interested in the last few years in how VR could be used as a classroom tool. And I collaborated with another researcher at my university, Professor Chris Hastings. And starting about 4 years ago, we looked into how VR could be used as a classroom learning tool. Especially now with the advent of smartphone-based VR and these very low-cost VR headsets, the Google Cardboard headsets that you see in this picture. It's possible to use VR in many language classrooms now, when before it was impossible due to cost. I then became interested in how VR could be used as an anxiety reduction tool. And with Professor Hastings, we designed a few programs to help students get ready to study abroad, with the goal of helping to reduce their study abroad anxiety pre-departure. So we designed activities using Google Street View and Google Maps and created VR-based preparation activities that would help them learn about the place they'd be studying and take virtual tours of the campuses. And then eventually I got interested in how VR could be used for public speaking practice. And I presented about this with Professor Hastings, but I also decided this would be the topic of my PhD at Nagoya University. So this is the basis for my talk today. So I'd like to discuss a little bit about what I did in my program. So some of the key concepts for this presentation. First is that anxiety is highly pervasive within society, but also within the student population at universities. Anxiety in the classroom can have a very negative impact on classroom success and our ability to instruct these students. We'll discuss some of that today. And there's also a lot of evidence from psychology literature that VR-based therapy can be very effective, and I'll talk about how I used these techniques in my program. And also found that there's a gap in the literature for how to reduce the public speaking anxiety of Japanese university students. So I want to talk about that. So first, let's talk about anxiety a little bit. Anxiety is how we react to aversive events. But the important thing is that this reaction can be psychological and it can be physiological. You can have mental and physical reactions to anxiety. It's very pervasive. Anxiety disorders are the most commonly diagnosed disorders in many Western countries, including the US. So we can assume that in our student population, many people are coming into the classroom with pre-existing anxiety-related disorders. There are many types of anxiety. Social anxiety disorder is its own category of anxiety. And then even within this, there's generalized social anxiety disorder. And there's also specific types of anxiety disorders like this. So public speaking phobia is a specific type of social anxiety disorder. So anxiety can have a big impact on our ability to teach and students' ability to learn. One of the big factors is that universities around the world are being pressured to produce students who have public speaking skills. And a lot of employers and big companies are telling universities that their graduates are not capable of the presentation skills that are required for many workplaces. So universities are feeling this pressure to teach these skills. There are a lot of terms for the types of anxiety that students are facing in our classrooms. Communication apprehension is a term used a lot in psychology for this kind of interaction-based anxiety. But there's a specific one for classrooms, classroom communication anxiety, CCA. And both of these can have a negative impact on GPA. So students' ability to learn is directly impacted by this anxiety. And then there's evidence that their success in future employment is also impacted by these kind of social anxieties. Foreign language anxiety is its own separate type of anxiety that many students are facing. And it's in addition to these anxieties based on human interaction, like CA and CCA. It's distinct. I think all of us are language learners, and we've felt some anxiety about using our second, third language But some of this can be facilitating anxiety. You can be motivated through this worry of making a mistake to improve. But once this anxiety reaches a debilitating level, then we start to see this impact on learning that we're worried about. It's important to think about foreign language anxiety because it is directly connected to language learning success, but luckily it can be adjusted for by teachers using different methods. So for the kind of program like mine, it's important to be able to gauge the anxiety levels of participants. And there are a lot of diagnostic tools available, even to people who are not psychology practitioners or therapists. Some diagnostic tools that are widely used are the Beck Anxiety Inventory, the State Trait Anxiety Inventory, and these give you a picture of the anxiety level of yourself or people that you give this survey to. But it doesn't diagnose a disorder. It's a diagnostic tool. There's even a specific one for foreign language anxiety, the Foreign Language Classroom Anxiety Scale, developed by Horowitz, and I'll discuss my use of that scale in this program. So, anxiety is a highly pervasive disorder. Many of the people in society, many of our students are facing problems with anxiety, but luckily there are a lot of very effective ways of reducing anxiety. A big one is cognitive behavioral therapy. This is widely used because it's quite effective. And this basically has you target cognitive distortions. It's ways in which we distort reality with our thoughts, and this leads to anxiety and depression. And if you teach people how to recognize these cognitive distortions and redirect them, change their thinking, then subsequently their anxiety, their depression levels can also change. Mindfulness has also become highly respected and widely used because of its effectiveness as well. And I incorporated mindfulness in my program, so I'll discuss some of its tenets in a second. When it comes to phobias, there are effective ways of reducing these anxiety feelings through exposure therapy. And some of the most common types are in vivo and imaginal exposure therapy. In vivo, you put people face to face with the thing that causes them anxiety. But imaginal therapy, you just have them imagine the thing that produces anxiety. And the hope is to desensitize people to this anxiety-producing stimuli. But with the advent of VR, we now have another form of exposure therapy called In-virtuo exposure therapy. So you can use VR to put people in anxiety-producing situations with the hope of habituating them to these difficult situations. So you can see someone who's afraid of heights might be able to practice being in the situation like you see in the picture here. There's a good amount of evidence from the psychology literature that VR-based therapies can be effective, and they've been in use since the mid-1990s. So there's actually quite a long history of VR in therapy. It's sometimes called VR-GET for this kind of exposure therapy, VR-graded exposure therapy. But it hasn't become widely used among therapists until now because of its prohibitively high cost. But now with the advent of smartphone-based virtual reality and these cheaper headsets and hardware like the Google Cardboard that we saw, it might actually be possible to use this on a wider scale. In-virtuo exposure therapy has many benefits. When you look at the other forms of exposure therapy, there are some drawbacks. In vivo therapy can be too intense and too traumatic. If you're afraid of spiders, it might be very difficult to come face to face with a real spider when you're trying to desensitize yourself to it. And imaginal exposure therapy can be too far removed sometimes. Just imagining yourself standing at the top of a tall building might not have a strong enough effect. So VR can be very effective because you can expose yourself to these situations in a safe environment. And especially with social anxiety disorders, there's a face-saving element to VR that can be very useful. With social anxiety disorder, if you're practicing these interactions in VR, there's not really a risk of embarrassing yourself. So it's a great chance to practice these kind of interactions in a safe environment. There have been large studies that have looked at public speaking phobia reduction through virtual reality and have seen some success. So this encouraged me to design my own program for Japanese students. In the late 1990s, starting very simply, developing public speaking practice VR applications. But then eventually, Hewitt and Hewitt in 2011 developed a kind of suite of treatments that include virtual reality-based speaking practice and mindfulness training. So I emulated some of these techniques for my program. The results were very promising. There's an increased willingness to communicate in some of these participants and a reduction in this communication apprehension. So I wanted to see if I could design a similar program and see these kind of positive results in my participants as well. So like Hewitt and Hewitt, I also wanted to incorporate mindfulness meditation and mindfulness training into my program. So I based this on the work of Professor Mark Williams, formerly of the Oxford Mindfulness Center. And the basic tenets of mindfulness are a little different than what people assume meditation is often about. I think people have a concept of meditation as clearing your mind, trying to think of nothing. But mindfulness is more about trying to pay attention to what's happening inside you at any given moment and directing your consciousness in a purposeful way to see how things are inside you at this moment without judgment. And the promising thing is that you can see positive results from mindfulness training over a short period. Professor Williams says within about 8 weeks, you can see some of these benefits. So I thought with my short-term program, it would be great to introduce them to mindfulness and that we might actually see some benefit even before my intensive short program was finished. So based on all of this previous work, I designed the research questions for my program. And first, I just wanted to get at the nature and the extent of my participants' public speaking phobia. What are the causes? And what strategies do they already have in place for dealing with this anxiety? In addition, I wanted to see if a short-term intensive program could have an effect on their anxiety, their public speaking anxiety. And I also wanted to see if there would be a difference with participants who used virtual reality to practice presentations and those who use more traditional imagination-based practice methods. So from these research questions, I have two hypotheses. Two factors, so one within groups factor and one between groups factor. So H1, that there will be a difference over time, that this kind of intensive short program will see a reduction in public speaking anxiety from before and after the program. And then H2, that the VR-based group will see more of a benefit than the imagination-based group. This is the first year of a 3-year study, and I should also say that this study was funded by a grant and aid from the Japanese government. So this first year of the program, I wanted to start small with just 20 participants and try to go in depth and answer some of these questions. So I recruited 20 foreign language majors from my university, all studying foreign languages like English, Spanish, Chinese, German. All of them were in their first or second year of university study with a mean age of 19.3 years. 85% female, but this is pretty typical for many foreign language programs in Japan. I wanted to get a sense of their English language ability, so I asked them to report TOEIC scores, but half of them had not taken TOEIC before, so I couldn't get good data on this. So instead, I wanted to group them into the control and experimental groups based on their pre-existing anxiety related to public speaking. So I gave them a pre-study survey and I asked them to rate their public speaking anxiety on a 4-point Likert scale, from a little anxious to extremely anxious. And I used this to balance the two groups so that the overall anxiety level of the participants in both groups would be the same. Okay, I'd like to get into what I did in this program and some of the treatment methods that I used. So I had two groups, control, experimental. All of the participants basically received the same type of training, but the main difference was what kind of practice they did at home. So all of the participants received presentation skills training. They learned about mindfulness, they learned about breathing techniques, and they learned some techniques for emotional regulation, how to notice a panic response when you're doing public speaking, and how to regulate these feelings of panic and direct their focus towards their goals. I also gave them chances to talk one-on-one with me and also have discussions with other participants. So Group A was the control. So at home, after each session, they did some practice. Group A using imagination-based practice techniques, and Group B were given VR headsets and trained in how to do VR-based home presentation practice. So this was a short-term program. I met them over 4 research sessions. It took about 6 weeks with different combinations of participants each time based on their schedules, but always grouped by control and experimental. In the first session, we talked about the program and I had them sign their consent forms, and also they took the foreign language classroom anxiety scale to measure their baseline foreign language anxiety. But I also did extensive individual interviews with each participant. Then we did presentations in front of each other to check their baseline presentation ability, and we also monitored their heart rates while they did that. And then I began the opening lecture and talked about some of the details of the program. Each time at home, they had some homework to do. So this first session after this, they wrote down their expectations for the program, and they also wrote about some of the negative self-talk that they do when they're doing a presentation or after a public speaking event. In the second session, we got into the heart of the program, and I started teaching them about what happens in the body, in the mind, when we have a panic response, and how to use positive self-talk, positive imagery to emotionally regulate, and also how to use breathing techniques and delivery methods like good posture and gestures to help reinforce this mind and body connection and be able to reduce this panic response. And we also discussed the basics of mindfulness. So in this session, they also learned about deep breathing, and we practiced a 3-minute mindfulness meditation together. So after this session is when they started the home presentation practice. So I had them do step-by-step, use some of the techniques from the program, positive self-talk, positive imagery, go through a meditation on their own using guidance that I recorded, and then do some presentation practice based on a topic that I gave them. Control group did this by imagining an audience in front of them and talking to this imaginary audience. The experimental group used the VR app that I'll describe in a second and practice presentations. And when they were done, they wrote some reflections. And I should also say that everything in this program was bilingual. So all of the materials they were given, all of the PowerPoints, all of my explanations were done in English and Japanese. So they were able to do all of this practice in their preferred language as well. In the third session, we got more into how to design a good speech and how to structure a good talk. And I also showed them how to find presentation role models to base themselves on. We also talked a bit about cognitive behavioral therapy and what a cognitive distortion is. And we looked at some examples of cognitive distortions related to public speaking. And then we went into more advanced mindfulness techniques. I also gave them time to share their journals, and we did some activities like creating a worst case plan where they thought about the worst thing that could happen during a presentation and made a substantive plan for what they would do if that worst case thing happened. So a lot of activities like this to help them. At home this time, again, step by step, they chose some of the program techniques to try to reduce their anxiety. They did a mindfulness meditation on their own using my guidance, and they also did presentation practice again with a new topic, and then again wrote their reflection using Google Forms. In the final session, we recapped everything from the program. They once again took the foreign language classroom anxiety scale, and again I did closing interviews with each individual student. And this time we did presentations in front of the other participants, but they were given a list of all the program techniques and asked to choose some of them and use them to help regulate their anxiety while they're doing this final presentation. And then we finished off by talking about their future plans. And after the program finished, I asked them if they would like to, they could submit another reflection after they do a real-world public speech act and tell me how well the program techniques worked with them. Okay, so what kind of VR training did the experimental group do? So I gave each of these participants their own VR headsets to take home, actually the same model you see in this picture here. And they were trained in how to use the Virtual Speech smartphone app. And this is a free-to-use smartphone application for iPhone, for Android, that lets you practice public speaking in different situations. So you can practice in a large room with many people watching, or a more classroom-based setting like you see in these pictures. Okay, so I used the mixed methods of data collection for this program. So first I'll talk a bit about some of the quantitative data that I gathered. So during the individual interviews in the first session and the last session, I asked them to rank their public speaking anxiety on a scale of 1 to 10, with 10 being the highest. Just looking at the raw scores here, you can see where they started and where they finished over the course of the program. And the A participants are control, B participants are experimental. And you can see just here from the raw scores that all of the participants declared a reduction in their public speaking anxiety, except for one who stayed the same. And I also did a manipulation check to see if there were any differences between these two groups based on their session 1 reported scores, and there were no significant differences between these groups. So that made me feel like I balanced the two groups pretty well. Looking at just the mean score change, there was a reduction in both groups. So there was a 38% reduction in this self-reported anxiety in both groups. So they both were reduced to the same degree. Checking for significance, though, so I have two factors here. I have a factor of time within groups factor of time before and after the program. Was there an effect? And also a between subjects factor of the treatment type. So was VR more effective than imagination-based practice? So with the within groups factor of time, I decided to use non-parametric tests for these because of the small sample size, only 10 people in each group. So I used a Wilcoxon signed rank test for this first factor, and the different scores were approximately symmetrically distributed as assessed by a histogram with superimposed normal curve. For both of the groups, control and experimental, there was a statistically significant median decrease in their self-reported public speaking anxiety from before and after the program. So this supports H1 that this kind of short-term program can have a positive impact on their public speaking anxiety. You might see a reduction. The control group had a p-value of 0.007, experimental a p-value of 0.005. So this is an encouraging sign. Checking for significance with the between subjects factor of treatment type, I also decided to use a non-parametric test. I used the Mann-Whitney U test. And again, the distribution of scores were similar enough to use this test. This time, there wasn't a statistically significant difference between the two groups. So there wasn't evidence that the VR home practice was more effective than the Imaginal training that the control group did. It's not to say that the VR wasn't effective. It was just effective to basically the same degree as the imagination-based practice. I also gave them the foreign language classroom anxiety scale developed by Horowitz, and this was just to see if anecdotally there would be any difference in their foreign language anxiety from before and after the program. I didn't specifically target language skills in my program, but they do a lot of presentations in their foreign language classrooms, and this can be a source of language anxiety for them. So I was curious if we'd see a difference before and after the program in their foreign language anxiety. This scale runs from 33 points to 165 points, and you can see where each group was as far as the mean scores go at the beginning and at the end. So both groups saw a slight reduction in the mean FLACUS scores from before and after the program. Again, I used non-parametric tests to check for significance here, and the results this time were more mixed. In the control group, using a Wilcoxon sign rank test for both of these, there wasn't a statistically significant difference before and after the program in their FLACUS scores, but the experimental group did see a statistically significant median decrease in their anxiety. Using a Mann-Whitney U test to check for differences between the treatment types here too, there again was not a statistically significant difference between the VR group and the imagination-based group. But this is all not that surprising because I didn't target language specifically. So if you wanted to design a program to reduce students' public speaking anxiety and foreign language anxiety, there would have to be a lot more foreign language skills development within your program. In addition to the quantitative data collected, I also had a large amount of qualitative data to sort through from the individual interviews with participants and also the home reflections that they wrote. So I'd like to talk about this a bit. For this, I used the thematic analysis based on the work of Braun and Clark. I used a realist framework with inductive analysis and a semantic approach. So basically, I was interested in the reality that students were creating in their own minds about this type of anxiety and how that reality changed over the program. In the first session, I asked them to describe their sources of their public speaking anxiety. And I found three overall themes from these answers, in that some of the sources were internally derived, some were externally derived, and then some were specific to speech acts themselves. The breakdown of answers was like this, with a slight majority talking about external factors causing their anxiety, but still a pretty large segment coming from internally as well. Some of the more common answers from participants involved a fear of making mistakes. And Japan is a high-risk aversion country, so this is not surprising. Making mistakes in front of your peers can often be anxiety-inducing. Externally, though, it seemed like people watching you, the idea of people's eyes on you seems to be anxiety-producing as well. In the initial interviews, I also asked them to describe their goals for improving at public speaking, and this might be interesting to us as instructors. Three big themes I found from these answers were that some of these goals were psychologically oriented, some were content oriented, and some were related to the performance of a speech act. They broke down fairly evenly between these three themes, but the most common type of answer involved improvement at content related issues. Some of the more interesting common answers were that they consciously wanted to reduce their nervousness and anxiety. So they were aware of their high levels of anxiety when they do public speaking, and they consciously wanted to reduce these anxiety levels. And a lot of them cited the desire to improve at delivery. A lot of students that I come into contact with have trouble using gestures or with eye contact, so a lot of them wanted to improve at this as well. So these are very useful for us when we design public speaking training courses. So I asked a lot more questions than just that. So in a future paper, I'll describe more of the themes from these other answers. But I'd like to also look at the closing interviews as well. So at the end of the program, these individual interviews, I asked them to reflect on what changes had occurred within them over the course of the program. And the two big themes here were improvements that were described and then remaining issues that the participants cited. Overall, the answers involved improvements. So the participants were very positive about this program and talked about how they had improved over the course of it. But about 13% of the answers involved issues that still remained. So very encouraging from the improvements section, though, is that a lot of the students cited the specific techniques that I had taught them and their belief that these techniques were effective and their desire to continue using them. And a lot of them cited the belief that their anxiety had been reduced over this program, so that's great. But issues still remain. So a lot of them still had lingering feelings of anxiety and still worried about some of their speaking skills or foreign language skills. So now I asked each of the two groups, control and experimental, to reflect on the practice they had done at home, the step-by-step practice that I had taught them. And the themes broke down basically into positive, neutral, and negative comments. So first from the control group, the group that did the imagination-based home presentation practice, they broke down like this. So a very big majority involved positive comments about this home practice from the control group, almost 90%. Some of the more interesting answers were that the participants in this group had a feeling of accomplishment from this home practice. So a lot of them thought practicing at home in this way was very effective and that they had improved their skills through this home practice. But interestingly to the research questions for this program is that this group had difficulty imagining the audience. So this shows some of the drawbacks of imaginal exposure therapy for public speaking. The experimental group was asked the same question to reflect on this home practice, but about the use of VR as well. Comments here either broke down to positive or negative, but this was more mixed than the control group. So only about 70% of the comments were positive, And a lot of issues involving this home VR practice were cited. So look at a few of these. A lot of them felt relaxed, they felt comfortable using this technology, and they also talked about how the mindfulness meditation put them in a good state to practice at home. But a lot of issues involving the problems with the virtual speech smartphone app were cited. And a lot of them talked about how they just got used to it over time and it became less and less effective. So virtual speech uses video. You're watching the virtual participants, the virtual audience move, but it's on a loop. So a lot of them noticed this loop over time, and they also realized that the audience wasn't reacting to what they were saying. So although I believe VR has a lot of potential for this type of practice, these apps that are available now, these free-to-use apps, do have some drawbacks, but I believe they'll continue to improve in the future, and some of these issues will be addressed. So in the interviews, in addition to asking them to rate their public speaking anxiety on a scale of 1 to 10, at the end of the interviews, I just asked them to reflect if they believed their public speaking anxiety had been reduced in a significant way. The two groups broke down like this. So the control group, all 10 of these participants said, yes, my public speaking anxiety was reduced through this program. The VR group, the experimental group, was more mixed. 70% said yes, but 20% yes and no, and then one of the participants wasn't sure. So a little bit of mixed evidence here to the effectiveness of VR, but overall both groups stating that their anxiety had been reduced. So some of the big takeaways from my program I'd like you to remember is that as instructors, we can have an impact on this type of anxiety over a short time. So the support for H1 that I found is encouraging to us that even over a short course, an intensive course, you can have a positive impact on students' confidence in public speaking. Through this program, we didn't see increased evidence that VR is more effective than imagination-based home practice, but both of these types of training were effective in their own way. So both are options. If you have more technologically oriented students, maybe VR is a good option. Students who don't want to use technology, imagination practice is still a great choice. From the interview data, we saw this mix of factors causing public speaking anxiety. So as instructors, we need to try to target all of these factors, the internally based sources, externally based sources, if we really want to produce students who are effective public communicators. And the limitations of the free-to-use available VR home speaking practice apps became clear, but like I said, a lot of these issues will hopefully be resolved in future applications. So I still have 2 more years to this study, so I would like to explore more of the qualitative data that I have and look into the written feedback, the home reflections they wrote, and also some of the post-study feedback that the students produced. And I'd also like to improve the methodology. So this year, I'm hoping to add a recording and VR playback function. So using panoramic cameras like you see in this picture, I want to record students doing speech acts and then have them watch themselves back using VR. And the advantage of this is that they can watch themselves and then they can turn around and watch how the audience was reacting to them as well. So I want to explore how this might also be effective for public speaking anxiety reduction. So here are my sources for this presentation. I've also included some of the books and literature that I used when I was designing the program techniques as well. So thank you for watching. Yeah, please contact me if you have any comments or anything you want to discuss, or if you're interested in any of the materials from my program. I'm very willing to share the prints and the PowerPoint that I created. Okay, thank you for listening.